So just like yesterday, you have 6 steps prior to beginning anything with your patient. All right, the very first thing you have to do before you touch any patient is what?
Verify
doctor's orders. All right, second thing is what?
Gather
Equipment, just like yesterday, right? So we're gonna go ahead and gather our equipment. So what do we need for equipment? So we need a gauze. What did I just do? Open it up and take it out, right? You need an alcohol pad. You can go ahead and open this up too if you want. Obviously you need a tourniquet. You need a vacutainer holder. This is a vacutainer holder. We're going to attempt 2 tubes of blood. These are called vacutainer tubes. You're also going to get a vacutainer needle from an instructor when they're ready. And that's it, right? So the next 3 steps, So the next step is a little different from yesterday. We're going to add a step into it, right? What is that? All right, Don BSI. So I'm going to put my BSI on. So we're going to put your face shields on first. I'm not putting the face shield on because it muffles my voice, and then you're going to put your gloves on. So after you get your BSI on, the next 3 steps are the exact same as yesterday, and it's the exact same anytime you do anything to the patient. Right? You're going to introduce yourself, then you're going to verify you have the correct patient using 2 patient identifiers, and then lastly you're going to explain your procedure and ask them if they have any questions. Okay? Good? All right, so the next step is to inspect arm for a good vein. So what does this mean? This means that you're just going to have your patient hold their arms out or just look at their arms, and if you see a really big vein, then that's the one you're going for. If you don't see any veins, you can ask your patient, hey, have you ever had this procedure done before? Have you ever had your blood drawn before? What arm do they normally draw it from? Okay, so he knows his body, right? So he knows where they're successful at. So that's another thing that you can do. All right, so once you've inspected an arm for a good vein, then you're going to go ahead and put a Chuck's pad underneath, or an absorbent pad underneath the arm, okay, just in case there's blood and you don't want to get blood on your table. So the next thing we're going to do is we're going to go ahead and apply the tourniquet, right? How far above the site? 2 inches. Just like yesterday. Today, so your arms are going to be like this. So what you're going to do is you're going to take your arm and you're going to stand it up just like this. We're going to start in the anus-cubital space, okay? This is where we typically draw blood. All right, so you guys are an expert on tourniquets, so I'm not going to cover that. Anytime you put a tourniquet on your patient, what do you tell them to do?
Make a fist.
Make a fist. All right, so then you're going to go ahead and palpate. What finger do we not palpate with? Thumb. We do not palpate with our thumb, so we're going to palpate with our index finger. So as you palpate, what should your vein not feel like? Rigid, cord-like, or roll or move, right? So what should it actually feel like? Should like bouncy, or it should rebound, okay? So once you locate your vein, then what do you need to do? Release the tourniquet. Okay, this tourniquet can only stay on for about a minute. All right, so now this is where we have to assemble our vacutainer needle to our vacutainer holder. All right. Now, there's one way that you're going to do this, and one way only. Real quick before I start that, to give you a little anatomy of this needle. This pink thing right here is a safety cap that goes over the needle after you remove it from your patient. Underneath this black cap is the needle that actually sticks to the patient. Underneath this clear plastic is a needle that screws into the vacutainer holder that actually punctures the vacutainer tube. Does that make sense?
Yes.
So we have to take this clear plastic off. There is tape that's holding on it, so remember that. In order to do that, we have to hold the pink and the black. Everyone say, hold the pink and the black.
Hold the pink and the black.
All right, if you do not hold the pink and the black, this black cap will come off and you could possibly stick yourself or drop the needle or contaminate, okay? So everything is done with the needle at eye level. You're going to twist this to break that tape that I talked about. And then you're going to take it off like a rainbow samurai unicorn, right? Just like this. My trash. You're going to pick up your vacutainer holder. You're going to have to move this a little bit. All right, is this sterile right here? Yes. All right, don't touch it, okay? So you're going to go wrist to wrist, just like this. Wrist to wrist. All right? And you're going to insert this and you're going to twist the holder. You're going to twist the holder. Do not twist the pink and the black. All right, you're going to twist the holder. So that's it. All right, what's this called again?
Vacutainer holder.
Holder. So what do you think you hold on to? It's a vacutainer holder, right? So hold on to this. Do not manipulate the needle like this. All right, so once you have that, you're going to set it down. So basically, we're pretty close to sticking, so we go ahead and reapply the tourniquet. I know it doesn't say in your lab sheet, but after you put the tourniquet on, what do you do? Tell them to make a fist, right? Anytime you put a tourniquet on, tell them to make a fist. All right, so if we need to, we can relocate the vein. Remember those people who don't have veins, you might need to feel it again, all right? If it's big old fat puffy veins, then you really don't need to relocate it because you can see it. So once you locate the vein, then we're gonna clean it, right? Just like yesterday, we start in the middle, work your way out approximately 2 inches, never crossing over the same area twice. What are we gonna let that do?
Dry.
Awesome. So while it's drying, you're gonna go ahead and pick up your vacuum container holder. You notice I didn't pick it up like this, right? Pick it up, the vacuum container holder, just like this. You're gonna be face to face with this pink safety cap, and you're gonna pull this pink safety cap back. Where's my thumb at? Underneath. This is where your fingers need to be, just like this. All right, and then you're gonna come parallel to the deck. You're gonna pull this black cap off. Do not twist it, just pull. And it's, again, just this rainbow samurai thing. What do we need to find on the needle? What directions it face? All right, good. So you're gonna anchor the vein. Your sheet says 1 inch. Come back just a little bit further, please. All right. So we're gonna go ahead and come back. We're gonna anchor the vein. You guys did that yesterday. And you're going to go in at what angle?
15 to 30 degrees.
15 to 30. So you're gonna go past the bevel and just a little bit further. Now everybody get real close to where you can see. Does anything like this look normal to you?
No.
No, so please don't do that. All right, so we're gonna go in just bevel and just a little bit more. We're gonna take our vacuum container tube, and I want everyone to pay attention. I just dropped it in there, right? Now I'm gonna give it push it in like I'm giving a shot. You may or may not get blood with these mannequins. All right, so we're gonna let that fill up. You're gonna hear your instructor say, okay, the tube is full. So when you pull the tube out, you need to be very careful and cautious not to pull the needle out. You're gonna set this down, you're gonna take your last tube, and you're gonna pop it in just like you're giving a shot. You're gonna hear an instructor say your tube is flowing freely, the blood is flowing freely into the tube. What does that tell you to do? All right, release the tourniquet. When you release the tourniquet, do it nice and easy because you're gonna be moving the needle around the arm. So it's full, so we're gonna go ahead and remove this. We're gonna set it down, we're gonna grab our 2x2, we're gonna fold it in fours just like yesterday. You're gonna hold this above the site. Do not put pressure until the needle's out. I'm pulling the needle out towards you. You're gonna pull the needle out, you're gonna hold it straight up in the air, just like this. And you're gonna roll this down and tell your patient to hold pressure, okay? The reason why we come up, most people wanna pull the needle out and hold it right here. What are you telling your patient to do after this? Hold pressure, right? So what if they come in, they stick themselves, right? Or if he wants to come help, you know, right, what's gonna happen? All right, he doesn't know you have a needle, but if you have it up in the air, no one is gonna get stuck, all right? So your patient's holding pressure, you're going to safety your needle just like this until you hear a click. Then again, it's needle down into the sharps container. At this point in time, you would go ahead and put Coban or tape on your patient, but do not actually put tape or Coban on your patient. So once it's taped, you're gonna go ahead and pick up your blood tubes. What do we need to check?
For any additives.
If there's any additives, right? So if there's additives, you're just gonna simply invert it. Then you're gonna take your pen, you're gonna verbalize, I would label the blood tubes. Once you label the blood tubes, you are done touching your patient. So what can you do? Remove your gloves, wash your hands, and document.